Dr. Sarah Allen, and today we're talking about one of the most frustrating changes that women notice with the menopausal transition: cognitive changes or forgetfulness. Ever walk into a room and forget why you walked in there? Or went to go grab something and forgot what you went to go grab? This is for you. So let's break down what's really happening to your brain during menopause and perimenopause. How common is it? It's really common. In fact, of a study performed with 16,000 women, nearly half reported symptoms of forgetfulness and brain fog. So what's most affected? Well, most women report forgetfulness, difficulty with word recall, difficulty with concentration, or the ability to retrieve information quickly. And a lot of women just say they feel slower. But here's where you can find some reassurance. Your ability to learn new things and your ability to respond are typically not affected. Number one concern I hear from patients: am I losing it? Or am I developing dementia? And the answer is no. The mechanism of this is completely different. You're not losing your mind, your hormones are fluctuating. Although women account for 2/3 of the cases of Alzheimer's, the development of this before the age of 64 is exceedingly rare, and these cognitive changes are a result of hormonal fluctuation and not neurodegeneration. Let's talk about the science, and this is actually really fascinating. Estrogen isn't just a reproductive hormone, actually a major neuroprotective hormone, and you have two types of estrogen receptors in your brain: ER alpha receptors and ER beta receptors. So as estrogen levels drop in your brain, you have less support for neuron growth. You have reduced synaptic plasticity. You have changes in your neurotransmitters, increased oxidative stress, and reduced mitochondrial efficiency. These are important to regulate everything from synaptic plasticity to neurotransmitters in your brain. These are all why you begin to feel a decrease or a slowdown in your working memory, your attention, and your processing speed. But here's something most women never hear. They never hear about hormone therapy's benefits for cognitive symptoms and how these appear to be strongest during perimenopause and early menopause, the period when your estrogen levels are chaotic and fluctuating and your brain estrogen receptors are changing the most. This is often the period that we talk about as the timing hypothesis. So the earlier you start it, the more benefit you're likely to see from it. And it doesn't mean that hormone therapy prevents dementia. That's not what this means. But what it does mean is it can make a meaningful impact on symptoms like brain fog, difficulty finding words, focus and concentration, and your processing. And these cognitive changes, they're common, temporary, and often treatable. So if brain fog is affecting your quality of life, talk to your healthcare provider about it. Seek guidance in menopause care because support is available and you deserve to feel like yourself again. If this video helped you, subscribe, drop any questions you have in the comments, and share it with a friend.